in front of you to at least educate and inform you about this advocacy that we have for the children, not only of North Luzon, but of the entire Philippines. So, first, I just want to emphasize and review what Clubfoot is. Most of you know this. It's the scientific term is congenital talipes equinovarus. So what does it mean when you translate it? Congenital, of course, you know it's at birth. It's present at birth. Talipes means tali is ankle, pes is foot. So ankle and foot. So it's a congenital deformity of the ankle and the foot. Equinus or equino is the foot pointing downward, and varus is the foot and the ankle pointing and deviating towards the midline. So ito po, yung nakikita natin na picture, that's the deformity, the one on the left. So it's easily recognized, especially after delivery. When you deliver the child, you can easily see if there's a discrepancy between the left and the right. But sometimes, in about 50% of cases kasi, parehong feet affected. So once you see this deformity, then we will have to inform the parents of its presence. So the other deformities are in the middle part of the foot, parang meron siyang may crease dito, dun sa may gitna, and yung toes are pointing towards the middle also. So why do we need to know about this deformity? Why do we have to be aware of this? It's because in the world, there are about 175,000 children affected and born with club feet every year. So it's a significant deformity. And then, you being at the front lines, being the first to see these children, when they come, we should be able to recognize and be aware of the treatment options that we should go to. So why is it a problem? Because if left untreated, clubfoot can have devastating effects. First, for the child, they can end up illiterate because ayaw nilang pumasok, nahihiya sa deformity. They can be neglected by the parents because some would look at them as an abnormal child, and they can suffer lifelong poverty and abuse or bullying if they decide to go to school. For the parents, they can feel the blame of having a deformed child, and the stigma will stay with it. And in taking care of these children, they need special attention. Hindi makakapagtrabaho one of the parents, and they will have to take care of them. So mag-decrease yung family income. And for the community, the loss of the GDP in totality, if there's decreased income for the family, there's decreased income for the community. So, but the clubfoot doesn't have to be a problem because it's a treatable condition. And this is exemplified by these athletes. They're football players and gymnastics athletes, which were born with club feet but were treated properly with the Consenti method, which we will elaborate later on, and they're able to succeed in their chosen professions, in their chosen sports. So, this program is a global program of developing awareness and the identification of cases. So why do we have to go global? Why not just rely on these parents or the children coming to us in the clinics? Because if we follow the business as usual with the children being seen in the private clinics or in the government hospitals, the trend is we see less than 50% of these cases. Imagine if there are 175,000 children, we start treatment in about less than 60,000. So that's significant, and that will lead to significant morbidity and also deformity as they grow into their late childhood and into their adolescence. But if we go global, if we have a global program promoting the treatment of clubfoot, this is the expected trend. We will be able to treat about 70 to 80% of children born with club feet in their initial 2 years of life. So, ito po yung target natin with this program. So, briefly, what is Miracle Feet? Miracle Feet is a non-profit organization po based in the USA and dedicated to increasing the access to the proper treatment and care of children with club feet, in particular sa developing countries like us. So they were formed in 2008 by a group of orthopedic surgeons and parents of clubfoot children. So they came together to have an NGO which will help children with clubfoot globally. So their approach is threefold. One, they want to establish the quality of treatment that we will give. So there's a standard of treatment that all clubfoot children should have because it has a very good success rate of about 90 to 95%. So their steps are identifying local partners like the government and private hospitals, and then they train the healthcare workers. Not only doctors, we also train nurses, we also train midwives, we also train physiotherapists, and even medical students who are willing to volunteer for this work. And we can ask them or assist them in once they want to help in the clinics that we have. So the Miracle Feet program, they also provide the supplies needed for the treatment because this is a continuing treatment over several years. And if you spend for it out of pocket, it will drain the parents. So the Miracle Feet program provides for the materials and the treatment supplies. Now, they also increase access by creating a channel or a system of developing early diagnosis and establishing yung referral process po. So, we will utilize the help of the other health workers, the barangay health workers, the municipal health workers, and the provincial health office, and even the DOH. And even the information agencies, we already have coordinated with them, and they help in disseminating this information that we have a treatment program and it's all over the Philippines. Later I will show you. And later on, the bigger picture is this program intends to influence the policy of the government to come up with an established Philippine National Clubfoot program once it's time for the Miracle Feet program to move out of the country. Once they have done their job, so it's up to the government to absorb what was developed and to sustain it. So threefold po yun. So Miracle Feet has helped over about 30,000 children in 27 countries. So these are developing countries. And we are included in that. I have mentioned the standard treatment that we use for club feet patients, and it's the Ponseti method, which was developed and accepted globally as a standard of care for club feet in the 1990s. What does it involve? Actually, two phases po. One is you have to correct a deformity by doing, in these pictures, we do weekly stretching or manipulation, and then after stretching the foot to the desired position, we put them in a cast. So we do that weekly for about 6 to 8 weeks. So imagine if the parents will spend for this, the transportation every week, the materials every week, then they will really spend a lot. That's why we are fortunate to have this program with us, and it's nationwide. Now, with the correction phase, once we have straightened out the foot, the fourth figure, then part of it is correcting the pointing down deformity, the equinus. So that's what we call the tenotomy. We cut the tendon. Of course, this is under local anesthesia or under sedation, and so that we will fully correct in preparation for walking. So that's the correction phase. Now, once we have corrected, we do not stop there. Once we have put the foot in the correct position for walking, we will have to maintain it. So that's the second phase, the maintenance phase. Okay? So we use bracing. Once we have completed the correction, we brace them 23 hours a day for 3 months. So that's to maintain the correction that we have achieved. So we remove it when the child should be given a bath, and that's it for the first 3 months. But after 3 months, when we have maintained that correction, and this is usually the time when the child starts to pull up and start the first steps. So we do that and we apply the brace only during sleep time, so during naps in the afternoon and in the evening. So this is the maintenance phase. So very important, yung orange text natin, we emphasize our trainees that always talk to the parents because they're crucial. The child cannot decide for themselves. The parents' compliance is very important and they should be part of the treatment. So there are different types of braces. There's a Bonsetti brace and there are several designs. But the Miracle Feet program, they have upgraded and transformed this clubfoot treatment through technology and innovation. What are the examples? The first one is they came up with the Miracle Feet brace. This is a low-cost brace which was designed in the University of Stanford, and it's funded by Google. And the shoes are made by Clark's. So it's of good quality. And these are provided for free. They are shipped to us, and these are provided for free. They have also developed a phone-based app to input the data that we collect from the patients. The pictures, the scoring, we do scoring. So we call it the Clubfoot Assessment Tool. So that's CAST, C-A-S-T. We also use a frequent communication channel with the parents. So we provide those coordinators, the site coordinators, access by calling or texting the parents when it's time for them to come, or asking them if they cannot come, then setting up a new schedule. So active talaga yung follow-up schedule ng mga pasyente natin. And of course, for the trainees, those who participate in the clinic, they are trained by e-learning modules, and this was originated in their programs in Africa. So with the presence of Miracle Feet, it's time to upscale the national response to clubfoot treatment in the Philippines. I've shown you the global statistics. In the Philippines, there are more than 3,500 children born with clubfoot every year. So it's still significant. So before starting this clubfoot program from Miracle Feet and PNGOC, these are the statistics. So the treatment gap in clubfoot cases in the Philippines, the ones in orange are those who are untreated or considered neglected. And the one in blue is those, or the one in violet are those who are treated before the age of 2. So look at the difference. So this is for the whole Philippines, only a very small proportion of children with club feet have access or are being brought in for treatment in their early childhood or in their newborn stages. This is unfortunate because every Filipino, no, should have fair, just, and equal access to healthcare. And this is mandated in our Constitution. One of the main reasons, actually, that this happens is that there is no established national program for the treatment of clubfoot under the Department of Health. So, parents, the ones who can afford it or who are aware that there's an existing treatment clinic, they can only avail of them when they go to the private doctors or a few government hospitals who have this capacity. The main reason why Filipino children with club feet have no access to proper and timely consented treatment is the lack of awareness. Where to get treatment, and that it's a treatable condition. And actually, as I said, with the Bonsetti method, 95% of cases are corrected when started early. So financial and affordability issues are also reasons, and sometimes the healthcare providers, the guardians, the parents are also overburdened. And very important yung family support kasi. So if we will help the family support these children with a deformity, then they will be able to cope and allow us to treat these children. So last year, na-mention ni Dr. Eden, a partnership between PNGOC and Miracle Feet came about. No? And it's about this Clubfoot treatment program in the Philippines. The implementation model for this program is eightfold, and we start with awareness. So when a child is born with clubfoot, so all of you will be aware of its presence na, you know how to assess, how to evaluate, and that it's a treatable condition. So once we have a child with a deformed foot, and we know that there's a program that can treat these children, then we can send them over. So that's the step 2, which is identification and referral. The Clubfoot Clinic, capacity training, casting, tenotomy, and the foot abduction braces, they're part of the Clubfoot Clinic team steps. So we can take care of this, those who were trained to do the manipulation, the casting, and the bracing. So just send them over. A very important role for you is the awareness, identification, and they also follow up with you, or if you have community members, yung sa last part din, yung sa adherence, to make sure that they go back to the clinic for follow-up because it's a serial treatment. So with all the components of a successful program in place, all we have to do is implement it and participate in the promotion and the awareness campaign. So Miracle Feet and PNGOC, they provide with the necessary materials and the necessary things that we can use to promote this program. So may mga generic posters that they can give us. I think Dr. Eden, your staff, they have the posters, and we also have the flyers for this. And even the contact numbers of the coordinators for the clinics, we can provide them. They also have the presence in social media. So this is for the Philippines. The Philippine National Clubfoot Program, if you want to check sa Facebook, meron yun. PNGOC and Miracle Feet also train medical staff and paramedical staff in the treatment, the manipulation. So as I mentioned, may corrective phase and may maintenance phase. We train the medical and even the paramedical, including the midwife if you are interested. So, actually this is not current plan. According to Dr. Eden, it's about 25 clinics. So this was a few months back. About 14 of the 17 regions are already supported. And the newest member in the North Luzon area is Baguio General Hospital. So it's a traditional. So if we look at it, there are now 6 active miracle feet clinics only in North Luzon. But if you look at this diagram, it's present in the whole Philippines. So they have in Bacolod, in the Visayas, we have it in Mindanao, Zamboanga, Davao, they have it. So, and they have patients who are coming regularly. So these contact numbers are for the North Luzon Miracle Feet network of clinics. But if you're from the Visayas, from Metro Manila, and from Mindanao, you can have the contact numbers of those clinics in our staff outside. So what do we provide in the free clinics? So we provide free consultation and assessment. As I said, the cast materials, the plaster of Paris, and even the cast padding. And once it's time to cut that tendon, to put it in the final position, we also provide for the procedure and the materials, as well as the shoes and the brace. And on special occasions like Christmas celebrations, Christmas parties, and the World Clubfoot Day celebration, we also invite the parents, the guardians, and the caretakers, the children, to come and celebrate with us. And counseling for parents every time. If they come to clinic, they have problems, they have issues with the cast or how to maintain the brace, we have a designated site coordinator who will talk to them and counsel them on how to adjust to this and how to contact us if there's a need. And even the transportation expenses of those children, those families who come from far-flung provinces, but they are willing to participate. So this selective, we can even provide for their transportation expenses. All we need to do is to register them in our clinic. So we follow certain steps, the protocol. We register them in the database, in the mobile phone app. So once they come over, they're interviewed, and the parents or guardians will sign the consent form for treatment. And then we will assess them. The clinicians will assess them and score that deformity, because the score will be our guide whether we are achieving good results or we have to take off some other form of treatment. So it's standard. And then the manipulation, the casting by the consenting method, we do that every week. Counseling and how to take care of the cast for 1 week. We also emphasize that. And we set up the follow-up schedule. The next time that they should come to us, and if they cannot come, we call them. So we are provided with the means to do that. So that's the SMS and call reminders. That's part of the clinic's responsibility. We have site coordinators for that. So this is just an example. In Baguio, we already have a Facebook page. So if they have questions, they want to keep in touch, they can go ask questions. The site coordinator will actually answer them immediately. And we also want to utilize the healthcare provider network for the Clubfoot treatment program. So we have identified our health officers, our municipal and barangay health workers as partners. So we talk to them, we inform them, we invite them in seminars and even orientation about the program so that they will be aware. So very crucial ang involvement ng family and community medicine doctors, the Health Education and Promotion Office of the DOH hospitals, and pediatricians, the obstetricians, and the midwives. because kayo po ang nasa front line who will see these patients. Because the best time to start the treatment is during the first week of life.
First week of life.
Yes. So once you see them, you can just send them over.
Okay.
But even if they're on their 6th month, it's okay. We can still start the treatment and we end up with good results. Preferably before they reach the age of 2. Before the age of 2. But the best results is when we start the treatment during the first week.
And then,
so we have established a network of clinics here in the North Luzon area, and we also have partnerships with our private and district hospitals. So if they see patients there, they don't have the means to handle them, they just send us these patients. And of course, tri-media is still important, TV, radio, and print, as well as the social media. So Clubfoot treatment involves a whole health system approach. So all levels of healthcare should be involved, from the antenatal care, community health, the clinical level, and it's always a joint effort with the parents, the caregivers, or the guardians. So actively involved talaga yung parents and the guardians. And this treatment is economical because they will spend a very little amount, maybe coming to you, but we can provide for their transportation expenses going back to their homes. So, ito lang po ang gusto namin emphasize about the roles and the task sharing of the health workers, tayong lahat. Ang importance po ng ating mga partners sa healthcare provider, dun sa 8 steps na sinabi ko, are the first 2 and the last. It's developing awareness, identifying and referring these patients that there is an existing Clubfoot program in the area, in the province, that can treat your children with deformity. And it's an economical treatment that most of the time, they will just spend a very little amount for a substantial time of treatment. And the adherence. Because even if our site coordinators, our clinic coordinators, keep on calling them, very important din yung presence ninyo sa community to remind them, are you following up with their treatment? So, yun po ang hinihingi namin. But the other steps, the Clubfoot clinic access, the capacity training, casting tenotomy, and the bracing, it's our responsibility in the Clubfoot clinic. So, parang joint effort po natin lahat ito. So as I said, it's a nationwide program. So this is in Bacolod, one of the longest running programs. They have many patients. This is in Davao. And this is in Zamboanga. So it's not just in Luzon, so it's all over the Philippines. And I just want to remind that our goal is a world where every child born with Clubfoot can run, walk, and play for the rest of their lives. So I will show a video of that we have made for this purpose. It's also part of the awareness program. It's only about a 7-minute video. And if you have questions after this, feel free to ask Dr. Libreng or ask her.
Very helpful po yung tawag niya.
Yes.
Kasi po hindi ako personally hindi ko alam na may ganyan. Kasi vlog ko siya sa sa YouTube para mas maraming mga
main computer naman. So when we're setting up, if there are questions or clarifications about the program or the availability, pwede na po ninyong tanungin ngayon.
Doc.
Matanong lang po, is Clubfoot genetic? Say for example, if the mother or father are suffering from Clubfoot, ito ba ay mamana?
Sa ngayon po, the main cause of Clubfoot is still unknown. That's why it's called idiopathic Clubfoot pa rin. But there are genetic diseases which can also manifest as Clubfoot. So like if there are neurologic disorders and sometimes they're associated with yung mga syndromes na present at birth, it can also be manifested with a Clubfoot. But yung idiopathic Clubfoot po, which is the most common, unknown pa rin po ang cause, but there's also a genetic predisposition. So it can skip generations, but pwede rin pong mamana.
Sige po, meron pa pong pwede magtanong. May magtatanong po. Habang inaayos yung ating video. Okay na po? Sige, mamaya na po.
Okay na? Okay, good.
Ba ay may kapamilya o kakilala na pinanganak na kagaya nito, maaaring siya ay pinanganak may clubfoot. Kung hindi agad may iaayos, lalaki siyang may ganitong sitwasyon. Magiging mahirap ang kanyang pagtayo at paglakad. Ano nga ba ang clubfoot? Ang clubfoot ay isang deformity kung saan ang mata ay nakaikot papaloob na nagre-resulta sa pagtagilid ng mga talampakan. Ayon sa mga pag-aaral, ang clubfoot ay isa sa pinaka-common deformities sa paa ng isang newborn. Maaaring isa lamang o parehong mga paa ang apektado. Ang sanhi ng pagkakaroon ng clubfoot ay hindi pa lubos na natutuklasan. Ngunit, ito ay maaaring genetic o namamana. Ano naman ang mabisang solusyon sa clubfoot? Ayon sa mga dalubhasa, isang mabisang lunas ang Ponseti method na pinakamabisa kung may sasagawa sa tamang oras. Mas maaga, mas mainam. Pinaka-advisable na ito ay masimulan habang ang sanggol ay nasa 7 to 10 days old hanggang sa siya ay 2 years old. Ang Ponseti method ay may 4 stages. Ang casting o pagsasemento, tenotomy, isa pang casting, at ang bracing. Ang casting o pagsasemento ay sinasagawa sa loob ng 6 to 8 weeks. Ang cast ay pinapalitan kada linggo kasabay ng pagposisyon ng mga paa sa nais na pwesto. Susunod ang tenotomy. Ang tenotomy ay ang pagsugat sa Achilles tendon ng paa. Ito ay sinasagawa upang tuluyang maiwasto ang natitirang equinus deformity ng mga paang bumaan sa kada linggong casting. Pagkatapos nito, ang mga paa ay ulit na ikakast at hahayaang nakasemento sa loob ng 3 weeks. Ang huling stage ay ang bracing, kung saan ang mga paa ng bata ay sinusuotan ng clubfoot brace. Ito ay dapat na nakasuot ng 23 hours kada araw sa loob ng 3 months. Pagkatapos ng 3 months, ang clubfoot brace ay susuotin na lamang sa tuwing siya ay matutulog sa araw o sa gabi hanggang siya ay umabot ng 3 to 4 years old. Ang layunin ng clubfoot brace ay panatilihin ang naiwastong posisyon ng mga paa habang ang bata ay lumalaki. Ang Ponseti method ay naging standard of treatment na lamang para sa clubfoot noong 1990s. Bago yun, napakaraming madugong operasyon ang pinagdadaanan ng isang bata para lamang naiwasto ang kanyang mga paa na kadalasan na may hindi nagbubunga ng magandang resulta. Noong 2008, isang grupo ng mga manggagamot at mga magulang sa US ang bumuo ng organisasyong Miracle Fit. Ito ay naglayong tumulong at isiwalat ang paggamit ng Ponseti method sa mga developing countries gaya ng Pilipinas. At ang Miracle Fit nga ay nai-launch sa ating bansa noong 2013. Ngayon, ang Miracle Fit ay mayroon ng local partners sa 27 countries at sila ay nakatulong na sa higit 38,000 patients worldwide. Sa kasalukuyan, 19 hospitals na sa ating bansa ang kaakibat ng Miracle Fit. Kasama sa kanila ang ilang malalaking ospital ng Northern at Central Luzon at ng Kamaynilaan. Ilang ospital din sa Visayas at Mindanao. At ngayon, kabilang na rin po ang Baguio General Hospital and Medical Center.
Pagkapanganak ko para sa kanya, almost, nung binigay sa akin ng doktor yung anak ko, sinabi nila na gano'n nga, clubfoot daw siya. So ako naman na ina, nag-alala. Tinanong ko yung doktor kung paano clubfoot. So sinabi nila na parang hindi siya straight kumbaga. So tinanong ko po yung doktor kung ano yung effective na paraan para at least makalakad siya paglaki. So sinabi ng doktor na sasamintuhin para therapy hanggang 5 taon. Nireschedule kami for first consent. Sasamintuhin. Hindi siya makalakad. So parang yung anak ko is, syempre inisip ko yung kapakanan ng anak ko na hindi siya makakalakad paglaki niya. Kaya sinugaban ko kaagad yung sinabi nila na ipapasama ito para maayos. So ngayon, naka-brace na siya. Everyday na naka-brace for almost 23 hours. Except sa pagtigo, syempre tinatanggal. Tapos ngayon, maayos na yung paa niya, medyo nakakalakad na rin siya. Kailangan pa rin ng shoes para at least hindi bumalik. Ngayon, medyo tumatayo na siya, nakakalakad. Maayos na siya ngayon. Sa mga nanay na may mga ganitong sitwasyon din ng anak, nire-recommend ko na kailangan dapat habang maaga pa, mas maayos yung paayos ng anak natin. Para at least paglaki nila, hindi sila kawawa. Kasi sila din yung kawawa paglaki nila sila makakalawa.
Saving parang si Leah yun ah. Love nail.